Okay, update on our quarantine foxes here. We have Mufasa, which you guys named. It was either between Simba or Mufasa, and you guys chose Mufasa. And we have Azul, and he is hiding in his little crate. But Mufasa had to have his leg amputated, and I'll go more into details about that. And Azul has finally started eating, and I'll go into more details about what they diagnosed him as having. So both of these foxes were found up north Minnesota. They were clearly not wild foxes. His color does not exist in the wild. And this is a border collie. And his color is silver, but very uncommon in the wild, and you could tell by his personality that he was not a wild fox. So we can only assume that these guys were released by someone who didn't want them, because neither of them were claimed, and they both came from the same area, so we can only assume they came from a really bad place, since he had to have his leg amputated and he is very ill. So I'll go more into details of their recovery process and what's going on with Azul. Azul is stable and back home here at Save a Fox now, but that doesn't mean he is out of the woods. When he arrived to the ER, he was lethargic and anorexic. The vet did blood work, which revealed elevated liver enzymes and dehydration, as well as increased calcium value. The vet performed an abdominal ultrasound, and the results are most consistent with cholangiohepatitis, which is inflammation of the liver and gallbladder. His blood work was run again later after some supportive care, and his liver values had improved and calcium levels normalized. Azul received IV fluids, antibiotics, anti-nausea medication, and supportive care during his stay. The vet provided supported care therapy specifically for possible cholangiohepatitis and monitored him closely. We will be monitoring Azul closely now as he is stable and back in our care. It is critical for him to continue to show signs of improvement, and if not, or if he declines, he will need immediate veterinary attention again. The ER vet recommended that we see a specialist if we don't see improvement for further diagnosis and treatment options. He has many vet visits in his future as we monitor his health. Even if he begins improving, please consider making a donation to help us cover these veterinary costs and future ones. We cannot do what we do here without all of you, so thank you. As you see here, his leg has been amputated. If you've been following his story, you know that he came into our care with already having a severely damaged leg. So let's just go back and take a look at his x-ray from a couple weeks ago. So you can see here how busted up and broken this leg is. It is pretty bad, and we don't know how long it was broken for. He was found wandering around, and nobody claimed him until a rehab center picked him up, and then he ended up in our care. So we were doing weekly splint changes with him to see how well his leg might recover, because animals do amazing things, and sometimes their bodies recover from things we would never expect them to recover from. So we gave him a chance to see if his leg would sort of fuse back together. And as we took more x-rays, we did notice it improving, but we came to the conclusion that it wasn't going to be improved enough for him to not have lifelong pain from his joints not connecting correctly. So the veterinarian and I decided that amputation would be best to not have him suffer with prolonged pain. And as you know, we have 3 tripod foxes who all get along running around just great. So we can't wait to get him to the point where he can get out of this quarantine cage and enjoy his life running around. Maybe we can even introduce him to our other 2 tripods, Serby and Firefly. So we'll see. Stay tuned.